Our next speaker is Dr. Fran Assaf. She's going to be talking to you about how to heal your health and your life with advanced craniosacral therapy techniques. Please help me welcome Fran Assaf.
Thank you very much. Can y'all hear me? Because I just like to be closer to where the action is, so I'm going to be down here. And I wanted to say I feel so blessed. Tony's back there, and I have to thank you for scheduling me after two incredible speakers who have set up this whole subject, Dr. Julie Royal and then Frankie, who did an incredible job of giving you a lot of technical information. And I'm just going to follow up on their great information and talk about craniosacral and doing advanced craniosacral. And I hope the lady who asked about emotions is still here, because absolutely I'm going to be talking about releasing emotions through very gentle body work called craniosacral therapy, which is exactly using the system that Frankie talked about, the craniosacral system and also the myofascial system. All of the fascia that underlies the muscles and every part of the body, and really just has the memory of injury. And I wanted to give you a little overview of what is craniosacral therapy. It's very similar to what Frankie talked about. The kind of craniosacral therapy that I do is taught at the Upledger Institute, which is in Florida. Dr. Upledger is a DO, and it is very sad to hear that the DOs today don't know anything about the craniosacral system and the myofascial system. But he is very on to some incredible cutting-edge information. And the craniosacral therapy is a part of body work, but it's the only body work that I'm aware of where the body leads with its healing intuition and healing intelligence, and the therapist follows. It's a very gentle hands-on technique where you're working at the sacrum of the pelvis. The person is on their back usually. You put one hand on the bottom and gently one hand on the top. And the hand on the top has about a nickel's worth of weight. It's extremely light. Because what Dr. Upledger learned after many years of research is that the body responds so much better to light touch than it does to pushing and prodding. As Frankie said, when you pull it, it resists. If you gently allow it to unwind, give it a little help over the hump of unwinding, what you feel when you have your hands on that person is that you wait, and then you feel the tissues literally begin to soften under your hand. It takes a lot of learning of tactile sensitivity, but what you begin to feel is you can sense when the tissues move, and you follow where the body takes you and support it as it unwinds. And when you want to talk about emotions, there's a sensation that I've learned and understood in my intuition that if this doesn't happen after a period of time, or there's a blockage or a resistance, what I know is that there's an emotional issue trapped in there. And the emotional issue patterns will hold physical patterns in place, and physical injury or physical dysfunction or even toxicity will hold emotional patterns in place. So it's very important to work both those systems together and also to detoxify, because toxins themselves are a trauma to the body, and they live in that fascia as trauma memory and hold it just as if you pick something in your body with a baseball bat. It's a trauma to the body. Like if you've been held with pesticides or been exposed to a toxic chemical, that's all in there. And as you do the craniosacral therapy, what happens is it begins to relax. I am also, in addition to my private practice, I'm also the staff chiropractor for the Environmental Health Center. And that is a clinic for severely environmentally ill patients. And I do very gentle adjusting with them and almost exclusively do craniosacral therapy. And it helps with their detox. It helps with their tremendous muscle pain from all the toxicity that they experience. So I've seen it firsthand now for about 6 years, and they go together hand in hand. So what I want to talk to you about is taking a step up onto that plateau of craniosacral and talk to you about the part of healing the emotional aspects, the emotional trauma memory that lives in the tissues that Frankie mentioned. And as she said, and as Dr. Julie Royal said so well, the emotions that we experience, we embed in our body in different places. They go into the organs, the body will put them into shoulders or hips or knees, because it will try to move it away from the really sensitive part where all the organs are, which is your trunk. So many times when people will come in with a shoulder problem or a hip problem, a knee or a foot problem, and I find that it's not healing as well as it should, I'll check in with the body intuitively and find that there is an emotional block there. And then we'll do something called somato-emotional release, which is the advanced courses in craniosacral training. In somato-emotional release, somato meaning body, emotions meaning body, and then a way to let that out. Because what we believe is that we call it an energy cyst, where that energy gets deposited in an area, and then it creates a bigger and bigger dysfunction. And the only way to stop it and decrease it is to allow it to come out and then heal the tissue impact that happened to it. But what will happen with an emotional deposit, an energy cyst, is that it will just keep getting worse because it'll be kind of like a spiral out this way. It will involve more and more tissues. It'll involve more and more dysfunction. You know, it might start up in your shoulder, but there's so many muscles and fascia that are related to that shoulder that it will recruit more and more muscles to compensate for, as she showed you, for the lack of movement that person had. And the longer that stays in there, it just gets worse and worse because the body has to continue to compensate and your function becomes more poor. It can affect the heart. It can affect whatever organs, liver, colon, whatever that get involved and pulled into that spiral. So what we try to do is unwind that spiral structurally and then find out what's in the heart of it, which is the emotional issue. And the way we do that is literally, it's a very, I call it a sacred process, because what you are doing is that person is allowing you, and they sometimes do it themselves, to literally dialogue with a part of their body, for example, with their liver. And a patient asked me about mental health center a couple years ago, and she had an incredibly toxic liver, which most of those patients do have because the liver processes everything on the way in and everything on the way out. The liver is really the hardest working organ that happens, that is in use when you detox. So she came in and she had some back problems. We started working on her back, and I've been working with her for a while, and she shared with me, she said, I'm incredibly anxious. I said, what is going on? And she said, I'll this liver test back. And I find that my liver is like right on the edge of, it's just so toxic, the liver enzymes are up, and I'm so afraid that my liver is just going to die, and that I'm going to die. And she was just an absolute wreck. And you know about health. I mean, the more stress you have, the less your immune system works. And people that have very little immune system function that are so toxic, she was actually making her healing go backwards. She was suppressing her immune system, she was suppressing her body's normal healing function, and I could see that. I mean, she was just like, she couldn't sleep, she couldn't eat, she was just absolutely fixated that her liver was going to give out. So I said to her, would you like to talk with your liver and find out how it's doing? And her eyes got kind of big, and I took a chance because I didn't know how open she was. You know, it's not like being here. You know, I see people from all over the country, so her eyes got really big, and then she said, yes, I'd really like to do that. So I said, okay, just lie down and just get really quiet. And sometimes the patient can actually do it, but I knew that she wouldn't be able to do it. And I also do muscle testing. And I developed a way to literally talk with the body with muscle testing and talk with individual organs and other emotional issues. So I just asked her liver for permission to talk with her with this. And he said, yes, I've been wanting to give her this information. And before I go any further, you should know that every cell, every molecule, and every organ or functioning group of cells in your body actually has its own intelligence. It has its own sense of survival. And it's kind of like a hologram for the intelligence of the body. Because every part of your body has an absolute life force drivenness to it. It wants to live. And when it can come in contact with someone who has that same wish for it, it will try everything it knows how to do to communicate. That's why we have pain in our body. It's the only way your body can tell you to pay attention, something's going on here. So, her liver was, yes, I've been wanting to talk to her. And so I asked the liver, and I did it all out loud so she wouldn't freak out or anything, and I said, how are you doing? And this is all an intuitive proof. Her body was really talking to me as the liver. And the liver said, I'm doing okay. I'm working really, really hard, but tell her I'm doing okay. And I said, what do you need from her to help you to be supported? And the liver said, first, please tell her to stop worrying because it's putting more pressure on me, which was just so profound. And then it said, I need her to take this particular supplement. I need her to drink more water because I'm trying to flush the toxins out and I need, some extra water. And I need this, but mostly I need her to just know that I'm doing okay. I'm not going to give out. I am under a lot of stress, but if she works with me, we'll make it. And by that time, I was crying and she was crying because it was one of the most profound exchanges I'd ever had with anyone, body or body part, because she was thinking like her dad. And her body was telling her, I'm going to live. You just need to help me and just, go with me. And literally, her feelings started turning around. She was out of there in 2 to 3 weeks. And I got a note from her later that she was doing really well. And for me to be part of that was just such an incredibly sacred and such a privilege to be part of that. And so today, rather than giving you a lot more technical information about craniosacral, I have some of these stories, healing stories, that I want to share that I think will show you the power of craniosacral, advanced craniosacral, and the somatoemotional release. And I want to start with a woman who is, she's an incredible musician. When she was 3 years old, someone handed her a little baby violin and she picked it up and started playing it. She's a virtuoso, or whatever they call someone who brings all that talent in with them. She was absolutely a natural musician. And that's her passion in life. She had a really traumatic childhood, but still was the very first woman, especially her age, like under 30, I believe, who was a soloist on the stage of Carnegie Hall. She was the first woman to play solo there. And played there a number of times, a long time. And one night, she was playing there and ran across the street to a hotel. It was raining out, and she, of course, was dressed really beautifully and had heels on. She was rushing back, and there was a whole set of marble stairs. And as she started down the stairs, her heel slipped, and she started falling down the stairs and caught herself on the railing above and was literally hanging by her arm, right arm, and she was a right-handed musician, from the stairs, which tore up her whole shoulder. And after that, she started playing in pain until years later, she just had to stop playing over 10 years ago because she had so much pain, and as Frankie illustrated, started up here and then it started going down her back because of the muscles and the fascia system and more of her whole side got involved. So I started seeing her about a year ago, and she said, "Can you help me?" And I said, "Yes, I can help you. It'll take some time because it's an old injury, but we'll do the work. We'll unwind things. We'll handle the scar tissue." So as things started to progress, pain started to move. It started to get more intense, and it was like, this is not the normal progression in my work. So again, I tapped in and started checking in to see, and she's very intuitive also, has been doing a lot of personal emotional work. And I said, there's some issues going on here that are not from your fault. And we started uncovering things from trauma from her early life, marriage, things like that. And every time we would go in there, and this is about our third or fourth go around, the first thing we found is that she herself had put a protector into her shoulder when she was very young, in her shoulder. It was very interesting. And this protector was there so that she wouldn't be harmed as a child. And she put it in there herself. It was an aspect of her personality. And that's another one of the things that I found, is that the body, as I said, has a survival mechanism, and it will do anything to live and be safe. And even as children, we have unconscious wisdom about being in a dangerous environment or an abusive environment and things that we put in place to protect ourselves so we can live through it. And she had a case like that. And so we talked to this protector and asked her, it was a female energy, and said, "Are you ready to leave?" Because she was creating pain. She was in there among the tissues, creating tension in the tissues. And she said, "Yes, I know I'm creating tension. I know I'm giving her pain, but I can't leave until I have her permission, because I was put in there at a very young age. She put me in there to keep her safe. So the patient and I had to have a dialogue with her that said, she's safe now, she's an adult, nothing bad can happen to her, and your job is done, and you can leave and go in peace, and you don't have to work so hard anymore. And I know this sounds kind of strange. To tell you that I know what it is and how it works, I don't have any idea. I know that my experience is that there is an energy and an intelligence in addition to that person's personality. It's not something from out there. It's not an entity. It's not a demon. It is part of that person's personality that was in there to protect them. Sometimes I think it might have something to do with the multiple personalities that come out, but I don't even want to go that far because that's very dysfunctional. And this is something that is functional, but becomes somewhat dysfunctional when they're no longer needed. It's kind of like old childhood behaviors, like sucking your thumb or something. You don't need it when you're 22 years old. It's kind of like that. It's something that just outlives its usefulness. And I don't always understand it, but it's always a benign experience, and it's always incredibly profound. And so this entity, this female energy, said, I just need her to give me permission to go and for her to tell me that she is safe so that I know she's safe, because that's been my job all these years. And when the patient said, I want you to know I release you with love, I am safe, I can take care of myself, she said, okay, thank you, I'm out of here. And literally, it's kind of like that. That was one of the most incredible experiences I've ever had with that situation. And the pain decreased. And we've had a couple of other layers of things that have happened. But what I want to say is that this patient and two of the other patients that if I have time to get through them all, what I've actually learned in the last 6 months, 3 of the 4 people that I brought to talk about, the injuries that they have that we've worked on, where they have been ostensible, like one of the guy that I have was doing an arm wrestling contest for his arm. Another couple of people had car accidents and hurt different parts of their body. And I guess that's been my learning for this last 6 months, because all of those people in the area that had their injury, under that injury was this incredible amount of emotional energy system. And as we tried to work on the injury, and I thought, is there something happening to me? Am I not as good as I was before? And I would check in, and it'd be like this huge emotional undercurrent holding these patterns in place. For some people, it was really lifelong, that it was all deposited in these areas. And so just to, again, support what Frankie said, we deposit emotions if we can't deal with them, and sometimes when you're a kid, you just can't. And that's a survival mechanism. You have to put them away in different places. Otherwise, you'll be so overwhelmed that your nervous system will just be fried. A 6-year-old cannot deal with emotional abuse and those kinds of things, like a 20 or 30-year-old adult who can say, I'm leaving, or put up a boundary. When you're 6, you're 6. So we put it in different places so we can live, so our heart doesn't stop, so we don't get paralyzed, so our nervous system doesn't get contracted. And then as adults, we have these pain problems. Again, as Frankie said, it was a wonderful talk. These pains show up, and you say, okay, what in the world happened to me now? And I really think a lot of the back pain, many of my patients, not all of them are as open to delve into the emotional issues. And I have people that have recurring back pain, and they come in and I work on and put it back together, and then maybe in 6 months I go, hey, I did it. So those people are just not ready to understand that there's more. But I'm finding more and more people who are ready to say, what is going on here? And I want to get a handle, because I got things going on in my life, too, that are not really, things I want to be dealing with. So let me go on here. By the way, the musician's doing great, and she will play again. She's just, doing awesome. So let me tell you about this young guy, great guy. He's a skilled manual worker. He uses his arms with great skill to make his living. And he came in and he said, this is kind of stupid, because I've done this before, and I was out with my buddies, and I had to be the macho guy, and I was arm wrestling, and I just hurt my arm. can you help me? And I said, yeah, I think so. You know, do a little exam and everything. He said, you know, I don't think anything's torn, but you definitely strained your arm a good bit, you know, above and below the elbow or your shoulder. He said it was a big guy. He's not that big a guy. He said, I just had that flu. I was more strong. I said, I won't do that again. So we started working. And he, same kind of thing. He'd come back and he'd say, no, it still hurts. Can I work out? Nope, as long as it's sore, you can't work out. And I'm just like, okay, something's not right here. So check in, and he is a caretaker for his dad, who wasn't the greatest dad when he was young. And now he's there taking care of his dad that's very negative, very guilt-inflicting, and very dependent. In fact, he's over 30-something, and he moved out and was living on his own and moved back to be a caretaker along with his full-time job. And what we found was that there was a huge blockage in here, and intuitively kind of just asking his body, what had happened was that he's a very compassionate person, and he wanted to give and he wanted to help, but there was something that he had put in here that was blocking him giving any more of himself. Because he had already given himself away. His solar plexus was totally slammed shut. His solar plexus chakra, because he had lost his will. He had kept being put down by his dad. But, he's an only child. Like, he could walk out on him, but that's not the kind of person he is. So we've been working on, in fact, some layers of this. And we got down not too long ago to this layer, and I said, he's never done this before. And I said, just check in there and look. See what it looks like, it feels like. And he said, I think there's like a band there, and it's flat. See the color. And so I did a little bit of intuition with him, and his body said, he can take it out there. So I said to him, pick your weapon. Pick a laser, pick a, I don't care what, a saw, a hacksaw, drill, you know more about those things than I do. Pick your weapon that you like. And I said, just go there and cut it off. Give yourself, you went ahead in his mind's eye. And by the way, visualizations are incredibly powerful because the body does not know the difference between a visualization and reality. So all the work that people did years ago in visualizations is absolutely relevant. And you can move blocks, you can move energy through your body just by simply visualizing the happening in the body cannot tell the difference. You can bring in light, you can bring in sunlight, you can bring in a dark room, all of those things. So he did that, and he said, oh my gosh, literally within like minutes, he said, I can move my arm better. I just, I just feel so much better. And he has been open about it, and he's going to probably start seeing a therapist to handle some of the old issues and really start clearing out some of the old memories in his body. And I think we've got about 5 minutes. I'm going to wrap this up. And so he is doing great. And I wanted to illustrate that when people become aware of those emotions that are embedded in their body, they begin to have a paradigm shift. They begin to absolutely have a whole new viewpoint of not only like their structure, but how their emotions affect their structure. And he said to me, as we've done this work, words have started coming up like resentment. And he said, I've had these emotional, moments. And I said, that is so awesome because you're pulling that stuff out of your body, and it's actually going to make you healthier and move more of this out. So we're going to work some more because he's got more muscular stuff, but he's also probably going to get some counseling to deal with what he's going through, so he doesn't have to put it back in his body. He can get it out of his body and not have to go through that. So he's also doing well. So to wrap this up, I want to say that we all have issues we've experienced in the past or we're dealing with. And like we said, the emotions go into the body. So if you have some pain, think about what Frankie said, what we've been talking about, that it may not just be superficial structure. And also, I just want to say, if you have a fender bender, if you trip and fall and hurt a part of your body, it's very inconvenient, even to get words or something. But this is what I've learned in the last 6 months. If something like that happens, ask yourself, is there anything else going on here? If you trip and fall on your knee, the same knee 3 times, yeah, oh my goodness, bless your heart. Ask yourself, what is going on? What is my body trying to tell me? What's my higher self trying to tell me? And I want you to know that craniosacral and advanced craniosacral are very gentle. They're almost like a spa treatment. You're more relaxed when you finish than when you start. And they can help you to enhance the quality of the health of your body and your mind and your emotions and your health. And I have a minute or two. If you have any questions, I'll be happy to answer your questions.
What do you think of this?
We would have to talk. Every story is different, so we would have to talk. Anybody else have any questions? I do not pop meds. I do not do any type of cracking or popping. I do everything gentle. I follow the craniosacral mode that the body responds much more readily to gentle touch, even with really big guys, than with hard thrusting. I use the activator, and I use something called an archer stem, which is an electric activator. I never do any cracking or popping. I just think it's too much for our nervous systems today, where our adrenals are just so overwhelmed. It's just too big of an impact into the nervous system. And I really want people's muscles to relax. I don't want to twist them up and put more tension into them before I thrust. I want people to be relaxed as possible. 2 more minutes. Anybody got anything? Well, okay, then I hope you all got a handout, and I'll be out there if you have any questions. And thank you so much for sharing this with me. I really appreciate it.